10 everyday habits that silently enlarge the prostate and how to reverse them naturally. Prostate enlargement, medically known as benign prostatic hyperplasia, BPH, is a condition that affects the majority of men over the age of 60, often creeping in slowly and silently. While aging is a natural factor, many don't realize that daily habits can accelerate prostate growth, leading to urinary issues, discomfort, disrupted sleep, and reduced quality of life. The good news is that by becoming aware of certain behaviors and making intentional changes, it's entirely possible to slow, stop, or even reverse prostate enlargement naturally. Let's explore 10 everyday habits that may be harming your prostate, and what you can do instead to protect it. 1. Ignoring thirst and staying dehydrated. Dehydration is more harmful than it appears, especially when it becomes a long-term habit. As men age, the sensation of thirst diminishes, and many intentionally cut back on fluids to avoid nighttime urination. But when the body doesn't receive enough water, the urine becomes highly concentrated. This irritates the lining of the bladder and the nearby prostate, creating a low-grade inflammatory response that, over time, can contribute to the prostate becoming swollen and enlarged. Additionally, dehydration slows the flushing of toxins, allowing irritants to build up in the urinary tract. Many common medications, especially for blood pressure or allergies, increase fluid loss, further compounding the problem. To support prostate health, aim to drink small amounts of water consistently throughout the day rather than chugging large volumes at once. A good rule of thumb is to aim for pale yellow urine, a sign of proper hydration. Drinking enough water supports healthy urinary flow, reduces bladder pressure, and helps keep inflammation in the prostate at bay. 2. Sitting for long hours without movement. A sedentary lifestyle is one of the most underappreciated threats to prostate health. When you sit for prolonged periods, whether watching television, working at a desk, or driving, it places direct pressure on the pelvic area, which can reduce blood circulation to the lower abdomen and pelvic organs, including the prostate. This impaired blood flow means less oxygen and fewer nutrients reach the prostate, impairing its ability to heal and increasing inflammation over time. Moreover, lack of movement weakens the pelvic floor muscles, making it harder to completely empty the bladder, a condition that leaves residual urine behind, which can irritate the bladder and increase prostate pressure. Gentle movement, such as standing up every 30 to 45 minutes, walking for a few minutes, or doing light stretching, helps restore circulation, strengthen key muscles, and reduce congestion in the pelvic region. Even a short daily walk can significantly reduce your risk of prostate-related complications. 3. Drinking too much caffeine. Caffeine, while a beloved morning ritual, can be harsh on the prostate when consumed in excess. Found in coffee, tea, sodas, and energy drinks, caffeine is a known diuretic and bladder irritant. It increases urine production, stimulates bladder contractions, and tightens the muscles around the bladder neck, all of which can worsen urinary urgency, frequency, and incomplete emptying. For men with an already enlarged or sensitive prostate, this added stimulation can lead to a vicious cycle of discomfort and interrupted sleep. Furthermore, caffeine consumption contributes to dehydration, intensifying its negative effects. While you don't need to eliminate caffeine completely, it's wise to limit intake to 1 moderate cup per day and switch to decaf or soothing herbal teas like chamomile or nettle. These alternatives not only support hydration, but may also offer anti-inflammatory benefits for the urinary system. 4. Eating spicy and processed foods regularly. Many men enjoy bold, spicy meals and quick processed snacks, but a diet high in these foods can be a slow-acting irritant to the prostate. Spices such as hot peppers, black pepper, and chili powder can cause inflammation in sensitive tissues, including the prostate, especially when consumed frequently. In parallel, highly processed foods are laden with sodium, artificial preservatives, trans fats, and chemical additives that can disrupt the body's hormone balance, increase oxidative stress, and fuel systemic inflammation. These reactions contribute directly to swelling of the prostate and poor urinary function. Foods such as canned meats, instant noodles, frozen dinners, and fast food meals are the worst offenders. Over time, this kind of diet contributes not only to prostate enlargement, but also to obesity and metabolic issues, both of which worsen prostate symptoms. The key is balance. Focus on fresh, whole foods rich in antioxidants and anti-inflammatory nutrients, such as leafy greens, tomatoes, berries, fatty fish, olive oil, and nuts. These not only 5. Holding in urine for too long, many men develop a habit of delaying trips to the bathroom, whether due to busy schedules, social settings, or a desire to avoid nighttime trips. But regularly, holding in urine stretches the bladder and places pressure directly on the prostate, which lies just beneath it. This prolonged pressure can lead to irritation and swelling of the prostate tissues. Moreover, when the bladder is consistently overfilled, it may not empty fully even when you finally do urinate, leaving stagnant urine behind. This increases the risk of bacterial growth, infections, and inflammation, all of which further contribute to prostate enlargement. It also puts strain on the bladder wall, reducing its elasticity and long-term function. To avoid this, pay attention to your body's signals and urinate as soon as you feel the urge. Prioritizing bathroom breaks is a small but powerful way to prevent chronic stress on the prostate and maintain healthier urinary patterns. 6. Smoking or exposure to secondhand smoke. Smoking is a direct contributor to almost every major chronic disease, and prostate enlargement is no exception. Cigarettes and tobacco products contain thousands of harmful chemicals that impair circulation, reduce oxygen delivery to tissues, and significantly increase inflammation throughout the body. In the prostate, this means less blood flow, more oxidative stress, and a greater risk of chronic irritation, swelling, and even cellular mutation. Research also suggests that smokers may have a higher risk of aggressive prostate cancer. Secondhand smoke exposure can be just as dangerous, particularly for men who have quit smoking but live or work in smoky environments. If you currently smoke, quitting is one of the most powerful steps you can take to reduce prostate symptoms and prevent further damage. Benefits begin within weeks of quitting, with improved circulation and reduced inflammation being among the first changes. Don't hesitate to speak with a healthcare provider about cessation support, whether that's patches, counseling, or natural therapies. 7. Skipping regular health screenings. Many men avoid going to the doctor unless they're in pain, but this reactive approach can be dangerous when it comes to prostate health. Prostate enlargement and even prostate cancer often develop silently, without noticeable symptoms until the condition has progressed significantly. Simple and routine tests, such as a PSA, prostate-specific antigen, blood test, and a digital rectal exam, can help detect early signs of enlargement, inflammation, or abnormal growths before they cause major issues. Early detection offers more treatment options, many of which involve simple lifestyle changes rather than medications or surgery. It's also an opportunity to track trends in prostate size and urinary symptoms over time. Men over 50 should make it a habit to visit their doctor at least once a year for a prostate checkup, and more frequently if there's a family history of prostate issues. A proactive mindset can make all the difference. 8. Eating too much red and processed meat. A diet high in red meat, especially processed meats like bacon, sausages, and deli cuts, is linked to an increased risk of prostate inflammation and hormonal imbalance. These meats contain saturated fats, nitrates, and other chemical preservatives that can irritate the prostate and increase systemic inflammation. In addition, digestion slows as we age, making it harder to efficiently process heavy animal proteins. This not only contributes to bloating and discomfort, but also leads to weight gain and excess abdominal pressure, all of which exacerbate prostate symptoms. While meat isn't inherently bad, moderation is key. Limit red meat to once or twice per week and choose lean, organic cuts when possible. Replace some animal protein with plant-based sources like beans, lentils, tofu, and whole grains, which offer fiber and anti-inflammatory nutrients that support digestive and prostate health alike. 9. Carrying excess belly fat, extra weight, particularly around the abdomen, is more than just a cosmetic concern. It's a major hormonal and inflammatory trigger that directly impacts prostate health. Belly fat is metabolically active and releases inflammatory substances, called cytokines, that circulate throughout the body. These substances can irritate the prostate gland, disrupt testosterone levels, and promote the growth of estrogen, a hormone linked to prostate tissue enlargement. Furthermore, the physical bulk of abdominal fat places downward pressure on the bladder and pelvic organs, increasing urinary urgency and frequency. Even modest weight loss, just 5 to 10% of your body weight, can significantly reduce inflammation, balance hormones, and ease prostate symptoms. The most effective way to reduce belly fat is through a combination of portion control, reducing sugar and refined carbs, walking daily, and improving sleep quality. A healthy waistline, generally under 40 inches for men, is one of the best indicators of reduced risk for prostate enlargement and other metabolic conditions. 10. Not managing chronic stress. Chronic stress is often overlooked, but it may be the single most harmful habit for long-term prostate health. When you're under constant mental or emotional stress, whether from finances, relationships, illness, or isolation, your body produces large amounts of cortisol and other stress hormones. These chemicals create widespread inflammation and interfere with the normal function of your immune and hormonal systems. High cortisol levels suppress testosterone and increase estrogen, creating a hormonal imbalance that supports prostate tissue growth. Stress also leads to pelvic muscle tension, reduced blood flow, poor sleep, and a weakened ability to fight off infection, all of which compound the problem. To counter this, prioritize stress reduction as part of your daily routine. Deep breathing exercises, meditation, light stretching, journaling, walking in nature, and even talking to a friend can dramatically reduce cortisol levels and support healing. Sleep, laughter, and meaningful social interactions also act as powerful medicines for the mind and prostate alike. Conclusion: one habit at a time can change everything. Prostate enlargement doesn't happen overnight, and neither does healing. But the body is incredibly responsive when given the right support. Every glass of water, walk around the block, healthier meal, or moment of relaxation helps reduce inflammation, rebalance hormones, and relieve pressure on the prostate. You don't need to overhaul your life all at once. Start with 1 or 2 small changes this week. Drink more water, move more often, cut back on caffeine, or schedule that long overdue checkup. Over time, these small habits stack up to deliver real, lasting relief. Remember, you're never too old to heal. With knowledge, consistency, and support, your prostate can thrive, and so can your life.